Hello, today I'm going to be doing my presentation on human immunodeficiency virus, also known as HIV. I'm sure you've all heard of HIV. If you haven't, maybe you've heard of AIDS. HIV is the cause of AIDS. Back in the 1980s, AIDS was a huge epidemic. Now it is considered a pandemic. It is still an ongoing disease that we are trying our best to get rid of because it is so deadly. Unfortunately, HIV doesn't have a cure. There are only treatments for it, and you can only prevent it. So today we're going to discuss what HIV is, what are those treatments, what are those preventions, and how does it cause the disease of AIDS. So let's talk about what is HIV. HIV is a virus. It is specifically a retrovirus. And within those retroviruses, it belongs to a group called lentiviruses. Lentiviruses are viruses that slowly cause disease. So HIV does not make you sick right away. It takes years, it takes decades before you start feeling the symptoms of it. And so many people can go undetected for years and spread the disease without even realizing it, which makes it so hard to keep track of because it's not something that you automatically get sick of. You can have it and be asymptomatic. Some more about HIV is it's HIV's genetic information is stored in the RNA, and HIV has to infect white blood cells in order to replicate in the human body. So HIV replicates by infecting the white blood cells known as CD4 cells. They are the cells that fight infections within our immune system. And the HIV, once they take over and infect the CD4 cells, they will use them to replicate since they can't on their own. Usually CD4 cells help fight infections, but once HIV infects them, they kill off the CD4 cells, so that will weaken your immune system. Let's talk about some of its shape and what it uses in order to help take over the CD4 cells. So it is a spherical shape with an envelope surrounding it. And it is covered with glycoproteins that help attachment to the white blood cells. So the envelope has those glycoproteins. The glycoproteins will attach to the white blood cells using the CD4 cell receptors, and it will use those glycoproteins to enter the cell. Within the envelope, there's a layer called the matrix, and HIV does have a nucleus, which is in a capsid. The nucleus holds the RNA and enzymes reverse transcriptase and integrase molecules, which will help with HIV replication once they are inside the CD4 cells. So what disease does HIV cause? First, let's talk about some of the symptoms. Symptoms include fever, chills, rash, night sweat, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. There are 3 stages to HIV infection. First, there is the acute stage. In this stage, the person is very contagious due to high amounts of HIV in their blood. During the second stage, it is called the chronic HIV infection. HIV isn't produced in as high of levels in the blood as the acute infection stage, and those infected can be asymptomatic. So like I had mentioned previously, some people don't know they have HIV until they get tested. Thankfully, we do have tests now, but the chronic infection can last for years, which means you can be asymptomatic for years and you can just be spreading the disease without even knowing it. If HIV medication is taken during this stage, the person may never progress into stage 3, but if they do, stage 3 is the acquired immunodeficiency syndrome. In this stage, it is when the immune system is so damaged that the body endures opportunistic infections and without treatment, the person may only survive about 3 years. So HIV infects the CD4 cells, which affects your immunity. So after years of having HIV, of these cells continuing to replicate within your immune system, your immune system is going to be very weak. And so AIDS is what allows those infections like pneumonia and tuberculosis to wreak havoc on the body. So how does HIV cause disease? We're going to talk about that. So HIV can be transmitted through sexual transmission. It can also be transmitted through contact with infected blood. So this can be from sharing needles with somebody who's infected or from mother to child. From mother to child, this can happen during pregnancy, childbirth, or through breastfeeding. So like we had stated previously, HIV infects those CD4 cells, slowly killing them. HIV causes the weakening of the immune system. So people who are diagnosed with AIDS, usually their CD4 cell count goes below 200 cells per micrometer. With that, a weakened immune system, like I mentioned, infections can really wreak havoc on the body. These infections can be cancers like invasive cervical cancer or multiple forms of lymphoma. Other infections can also be tuberculosis, which is caused by Mycobacterium tuberculosis, and recurrent pneumonia, which is caused by Streptococcus pneumoniae. So someone who does not have HIV, they will be able to fight off these infections, but someone who has HIV that has progressed into AIDS will not be able to fight this on their own. Their system is severely weakened, and that makes them very susceptible to diseases, and it makes it very dangerous for them, because pneumonia can be what kills them, even if it doesn't kill the other person. It just has to do with their CD4 cell count. Let's talk about risk groups. So risk groups, there are gay and bisexual men who have the highest number of new diagnoses in the United States, transgender women who engage in sexual activities with men, and injection users who use needles have the highest risk of infection overall. Then when it comes to racial and ethnic groups, African Americans, Hispanic, Latinos are disproportionately affected by HIV. There are also behaviors that can put you at a higher risk. So if you don't use protection in the form of condoms during sex, you can be putting yourself at risk. If you are not taking preventative medications, which I'll talk a little bit more about later, and if you are sharing needles and syringes, those can all put you at a higher risk. The transmission of HIV is preventative. HIV can be prevented, but you have to know if you are HIV positive, you have to get tested, and you have to take the right medications or use the right type of preventative steps in order to prevent from getting infected. Let's talk about treatment and prevention. So one prevention that you can use is using condoms during sexual intercourse. You can not share needles. That's probably a really big, easy thing that you can do, is never share a needle with somebody. There are also HIV preventative medications. So there is pre-exposure prophylaxis, also known as PrEP, and post-exposure prophylaxis, as known as PEP. So PrEP contains tenofovir and emtricitabine, which are prescribed with other medicines to treat HIV. So PrEP can also help against transmitting HIV to a baby while trying to conceive, during pregnancy, and while breastfeeding if the mother is HIV negative. So if the father is HIV positive and they want to avoid the child getting HIV, the mother can take PrEP to help not only take care of herself, but take care of the child. Also, if the mother is HIV positive, she can take the HIV medicine, which I'll talk about in a second, and that will give her a low risk of transmitting HIV to the child, but it is still recommended to avoid breastfeeding. And then if you have been exposed, you can take PEP. PEP should be taken within 72 hours of possible exposure to HIV. That just helps. The chances, anything after that, the chances of preventing HIV are very low. So let's talk about antiretroviral therapy. So HIV has no cure. There is no vaccine that you can take for it, but there is the treatment of antiretroviral therapy, also known as ART. It'll help lower the viral load while keeping the CD4 cell count high. So your viral load is the amount of HIV in the blood. Like I mentioned previously, in the acute infection stage, your viral load is very high. It's very contagious for you, and you can spread HIV very easily. In the chronic stage, it's not as high if you are taking your medication, also, which is ART. So ART will help lower the viral load, and then it causes viral suppression, which means per milliliter of blood, there is less than 200 copies of HIV. With the load that low, HIV is undetectable by tests and not transmittable, which would help prevent spreading the disease overall. So HIV can be treated using that, and that is one way in which someone may never go into getting AIDS if they keep taking that medication. That medication helps keep your CD4 cell count high, so you are not as compromised when it comes to getting infections like pneumonia, tuberculosis, cancer, and so on. Another thing I want to mention is that HIV can mutate and it can become drug resistant. So HIV is a virus that has a high chance of mutating. That's why it's so hard to make a cure and a vaccine, because there are different strains. If you don't take the HIV medication consistently, you can allow the virus to mutate and to gain immunity to that. And then you all of a sudden have a new strain of HIV that medications might not work for. And if you can't take medications to lower your viral load, you can spread HIV. And so it is a never ending cycle. But there are things that they're trying to do, and they're still working on medications and they're still working on treatments. So yeah, that is the presentation on HIV. I will leave the questions in the comments. If you have any other questions, please ask and I will answer them.